Perfect. I'm Juan Carlos Caicedo. I am Hispanic Colombian transplant surgeon. I do uh, pediatric and adult abdominal transplants. I do kidney, pancreas, liver, small bowel transplants, and hepatobiliary surgery and advanced laparoscopic surgery. And I am the surgical director of the liver transplant program, as well the director of the living donor liver transplant program and hepatobiliary surgery, and the director of the Hispanic transplant program at Northwestern Medicine here in Chicago.
Okay, thank you so much for that. Now, do you have a set of ethical principles that you use when faced with difficult questions or situations in your career?
Can you repeat the question?
So I was wondering if I could ask you some questions about business ethics.
Yes.
Okay. Do you have a set of ethical principles that you use when faced with difficult questions or situations in your career?
Yes. Yes. I think all of us, and especially in medicine, everything that we do, usually there's some values and there's some principles that we use. First of all, always the autonomy of the patient. The patient has the right to decide if they want or not some treatment. Second, always trying to benefit the patient and trying to avoid harm the patient. And we need to be trying to do the right thing for patients. Then I think even though sometimes we have to do difficult decisions or sometimes life and death situations, we help our decision process considering those kind of principles, right? And sometimes, as like in any business, and we're dealing with lives, right? But in any business, I think anything that is worthwhile always is uphill, meaning that sometimes are very difficult decisions and it's not easy. And trying to do the right thing many times is difficult. But if you do the right thing, that will last longer. Sometimes you can take shortcuts to do something easy, but when you're doing the easy, sometimes that doesn't last too much. And then you will be in trouble eventually. Then I think sometimes it's better to do the right thing and take the hard decision. Is not, trying to cut the corner, take longer, but usually that is the right decision most of the time.
Okay, thank you. Now, would you be able to provide an example of a situation in your business career that you faced in which you applied these principles?
Then basically, it's in every day. I'm a transplant surgeon. Then basically all the patients that are dealing with, usually they have organ failure and they're dying. If we don't transplant, most of the time they have a higher chance of dying, right? Then if you don't transplant them, they can die. But there's a risk involved. But always what we need to analyze is risk benefit. Then, and always we're trying to proceed with any type of procedure, like bigger operations. We are doing even replacing 3 organs in one patient. We just recently did a heart, liver, kidney transplant in one patient, right? It's a big operations, massive operation. And always what we have to think is, first of all, the patient wants the procedure, they understand fully what they're entitled. And second, is the benefit outweigh the risk? And if the answer is yes, then we can proceed. But if we, on the other hand, we believe that the risks are higher than the benefit, then we won't proceed. Even though patients maybe say, I want the transplant, doesn't matter what. I said, no, but if your survival is very minimum and there's no chance that you can develop more complication, we shouldn't do it. Then, and sometimes it's not easy. because sometimes we have to go beyond what the person wants or believe. Is we need to provide the right information for them to make the right decision. That is still, and that is another value or another principle that we use, always trying to tell the truth. As we know, we are human beings, we are not God, and we don't know everything, we don't have a crystal ball to predict the future, and then we always need to tell the truth, even though maybe it's painful for them. And sometimes the family doesn't want to tell the patient, but I really believe that everybody needs to know the truth and face the reality. And knowing the reality, they can decide, and that is the autonomy. That is one of the principles. They can decide if they want or not. For example, there is another good example is the Jehovah Witness. They don't take blood transfusion, right? And sometimes there are situations that if they don't receive blood, they will die. But I cannot give them blood transfusion to save their life because they feel that based on their beliefs, that will affect the afterlife that they will have. Then even though the benefit probably outweigh the risk in the medical point of view, but in their beliefs, that will be wrong. And then that's why we cannot do it. Then always autonomy is kind of, well, trumped the beneficence and non maleficent when we are acting.
Okay, thank you for that. Now, do you think that any particular business question, decision, or situation represents a difficult ethical issue?
I repeat it again.
Do you think that any particular business question, decision, or situation represents a difficult ethical issue?
Yeah, many times, every day we are dealing with those, right? Because, for example, a typical case is patients that are too sick that the transplant will be futile, meaning that it won't work. And the big problem in transplantation in US as well in the rest of the world, there's more patients waiting for a transplant compared to the organs available. Just to give you an idea, there's 13,000 people waiting for a liver transplant in US today. We're transplanting only around 8,000. Most of the patients are not transplanted. Why? It's because there is not enough organs for everyone. And if we're going to use and this lifesaver organ, and we're going to use it in somebody that can survive, then multiple people are going to die. Not only the donor, if it's from deceased donor, sometimes could be from a living donor too. Then somebody alive can donate part of the liver, and the liver will regenerate in 3 months, so it will be almost the same size before donation. But if we're talking about deceased donor, then we have multiple deaths if the patient is too sick to survive the transplant. The donor who dies. Second, the recipient, if it's too sick to receive the transplant. And third, the patient that was not lucky enough to receive that organ. Then we cannot just transplant it because the family wants and they're upset or they're very important and they say, just do it. Say, no, because we need to also be stewards of these priceless resources, right?
Okay.
Then it's difficult decisions, right? Because it's what the patient wants, maybe what the family wants, but if it's the right thing to do. And then in every hospital, there is an ethics group that sometimes help us to make these difficult decisions. Then we get with them, we have a multidisciplinary teams, all the physicians, surgeons, clinicians, and nephrologists or pathologists, or whoever is needed, plus the ethicists, and then we discuss the case thoroughly to make sure that we're doing the right thing.
Right.
Then at the end of the day, we have to do the right thing in the medical standpoint, in the ethical standpoint, and also everybody has their own faith. Then I just need to make sure that I do the right thing in my faith and my moral principle, that many times that don't fight against to others, but still for me it's important. I'm a Catholic person, then I believe in my faith, and those principles that has been teach to us, I think are important, and sometimes that to help me to decide what to do too. Then always trying to balance risk benefits and trying to do the right thing. And sometimes it's not easy to define what is the right thing.
Okay. All right. Thank you for that. Now, do you have any advice that you can provide for me as I think about ethical issues that I may face one day in my career?
Right. I think this is very important. And I think I congratulate you to start thinking and to your age. You're still very young, but that means that you're also mature, that you are already thinking about these things. In life, people who goes further is people who has values, and values is part of ethics, is part of morale. I think it is essential. Um, and there is a lot of things written about leadership, um, and I think I really like, for example, an author, John Maxwell. He's a priest too. He's Christian, and he has written more than 100 books, and he talks about ethics and some of the laws of leadership. He based the laws in the Bible, in the Proverbs. Uh, um, then, but it's just to find at the end of the day what are your values, and everybody has different values. But we need to make sure that if you start your career, whatever is your career, whatever is going to be your business, you develop a set of values that will guide you when you have a difficult time. For example, if we're talking about the most important values, life, right? Then whatever else, you're going to earn $100 million, but you have to kill somebody, then you say, well, I rather don't get any penny, right? I lost $100 million, but don't go against one of your core value,
Oh,
life, for example, right? Then I think when we're talking about values, there's different, it's your first value, second, third, fourth. And always the first one is more important than the second one. And then you decide, right? I'm not going to go against life, for example, right? And then it depends on your values, you can decide, what do you have to do.
okay. Well, thank you for that. Once again, thank you for your time, Dr. Caicedo. This has been very helpful.
This is